wellness coach at Rosewalk Hospital, and I have with me Dr. Shelly, Singh, Senior Consultant Obstetrics Gynecology at Rosewalk. Hi ma'am.
Hi Mahima.
So today we will be talking about gestational diabetes. So ma'am, please tell us what exactly is gestational diabetes?
So gestational diabetes is defined as a diabetes or deranged blood sugars which are first detected in pregnancy or the onset happens in pregnancy itself. Prior to this, the blood sugars have always been normal.
Right. And how can a pregnant woman actually get to know whether she's having GDM or not?
So for most of the population, there are no characteristic symptoms of gestational diabetes. When you go for your testing, that means when your doctor orders a blood sugar test, which is also called an OGTT, this is done at 24 to 28 weeks and it is done with 75 grams glucose load. If there are abnormalities which are found on that, only then we are able to diagnose gestational diabetes. Some people are also at high risk for gestational diabetes, so we may need to do this OGTT test even at the first antenatal visit. And these people would be people who are obese, people who have a very strong family history of diabetes, people who've had gestational diabetes in their previous pregnancy, people who've had the delivery of a baby of more than 4.1 kg, people who've had stillbirth. So these people, along with some other metabolic problems like for instance polycystic ovarian syndrome, all these people are more likely to have gestational diabetes, and therefore we require to do their screening even at the first visit itself.
So I was going to ask you about PCOS only. So women who have, are going through PCOS, which I think most of the women are these days, what are the chances that they will probably experience GDM once they get pregnant?
Yes, so there is actually there is a correlation between PCOS and gestational diabetes. People who have PCOS are also more likely to have gestational diabetes.
Right. And ma'am, what are the effects on the mother or the baby in case a woman gets diagnosed with GDM?
Okay, so in case, let's just divide it into the effects on the baby and the effects on the mother. So the effects on the baby would be that there are 2 times a risk of higher birth weight. There is 3 times a greater chance of cesarean section and 4 times neonatal ICU care which will be required for the babies. These babies are generally born with they're big babies and they're born with greater birth weight. They're called macrosomic babies. And what happens is that sometimes during the time of deliveries they can have birth injuries. Then apart from that, there is a higher chance of cesarean section birth. Along with that, there will be increased chances of even problems like there will be problems like diabetes which can happen on later in life. There are chances of obesity, and even at birth there are some metabolic complications which can happen. For instance, there can be hypoglycemia at birth, and occasionally it's also been found that there will be stillbirths. So these are the common problems which can happen because of gestational diabetes in the baby. Whereas in the mother, we can have chances of since it's a big baby, there are chances that there can be a difficult vaginal delivery, there can be operative delivery, there can be perineal and vaginal tears which may be there, and of course a cesarean delivery. And these women are also prone to have diabetes later on in life because there's almost a 50% chance of having type 2 diabetes later on in life.
That's quite a lot of information, so please do not ignore it if you are experiencing GDM in pregnancy. So ma'am, what can a woman do once she gets to know that she has gestational diabetes?
So there is good news, Mahima. The thing is that if you have gestational diabetes, it's very easy to control. Most of the time, since it's a lifestyle disease, it's only lifestyle modification which helps. So first of all, we will ask you to eat healthy. So have a diet which is rich in green vegetables, which is rich in some of the things like lean meat, You can even have complex carbohydrates. You can even have things like nuts, seeds, etc. So all these, as well as the fruits, which have a low glycemic index and which are rich in actually nutrition, and they are low in calories as well as in fats. So eating healthy, small frequent meals including healthy snacking. We ask you to exercise at least 5 to 6 times in a week unless it is contraindicated, and this should be done for at least 30 to 45 minutes. Your weight should not be too much of a weight gain. You should make sure that there's not too much of a weight gain that is happening. If you begin pregnancy with a healthy, good weight itself, that's half the battle won. So basically, we ask you to take care of these lifestyle modifications. We also ask you to keep charting your blood sugars. You will be required to buy a glucometer. You will be required to chart your blood sugars at least 4 times in a day. And if required, your doctor will ask you even to go on either insulin or sometimes on oral hypoglycemic agents as well. These are medications which are used to take care of your blood sugar levels. And it's a known fact that if you control diabetes or your blood sugars well, there are less chances that there will be complications like macrosomia, increased amniotic fluid around the baby, and all these complications will definitely be less. So that is what is required. We will ask you also to keep, fetal surveillance has to come a little more frequently compared to a normal pregnancy, which means that we monitor the growth of the baby with the help of ultrasounds, with some other tests. And finally, if all goes well, delivery can happen very much at term at around 38 weeks of pregnancy, or sometimes even later than that if everything goes well.
Lovely. So I think all pregnant women should take care of themselves to prevent gestational diabetes. So ma'am, any preventive measures that pregnant women can follow?
Absolutely. So just as I've just been saying that it's a lifestyle problem, in the same way the prevention is also with the help of lifestyle, which means that take care of your diet, eat healthy, take care of your exercise, maintain an ideal body weight. Make sure that before you get pregnant also you have a good, your ideal body weight or close to ideal body weight as much as possible. Avoid having too much of junk food. Give up on smoking and try and give up on alcohol as well. And basically just take care of things like even yoga, meditation and other things which will just have a calming effect. So these are some of the ways in which we can just prevent gestational diabetes. Of course, we can't fight with our genetics, but at least we can lead a very healthy